Lupus is a complex autoimmune disease that causes inflammation in various tissues throughout the body. In autoimmune diseases like lupus, the immune system mistakenly attacks the body's own cells, leading to a wide range of symptoms. Lupus can affect the skin, joints, kidneys, heart, lungs, and even the nervous system. There are different types of lupus, including systemic lupus erythematosus, SLE, which affects multiple organs, and cutaneous lupus, which is limited to the skin. Discoid lupus is a form of cutaneous lupus that can cause scarring. Lupus is more common in women than men and can develop at any age, making awareness and early recognition crucial. Exact cause of lupus remains unclear, but genetic and environmental factors both play a role. People with a family history of autoimmune diseases are at a higher risk. Certain genes can make the immune system more sensitive, and external triggers like infections or sun exposure can set off symptoms. Hormonal factors are also important, as lupus is more prevalent in women, especially during their reproductive years. Some research points to the role of enzymes like DNase-1, which help clear out dying cells. When this process fails, it may contribute to lupus development. Understanding these factors helps in identifying those at risk and guiding preventive strategies. Not all lupus cases are spontaneous. Some medications can trigger a lupus-like syndrome, known as drug-induced lupus. Over 90% of these cases are linked to specific drugs, including hydralazine for blood pressure, certain heart rhythm medications, and some antiepileptics. Even ingredients in some vaccines have been implicated. Symptoms usually resolve once the medication is stopped, but it's important for patients and doctors to be aware of this possibility. Always discuss your medication history with your healthcare provider if you develop lupus-like symptoms. Lupus presents with a wide variety of symptoms, which can make diagnosis challenging. Common complaints include fatigue, low-grade fever, muscle aches, joint pain, and loss of appetite. Many patients experience arthritis, mouth or nose ulcers, and the classic butterfly rash across the cheeks. Sensitivity to sunlight, known as photosensitivity, is also frequent. Some may have reduced white blood cell counts, inflammation around the lungs or heart, and poor circulation to fingers and toes, called Raynaud's phenomenon. The diversity of symptoms means lupus can mimic other diseases, requiring careful evaluation. Lupus can affect both the skin and internal organs. Discoid lupus mainly impacts the skin, causing red, raised rashes that may scar, especially on the face and scalp. Systemic lupus, however, can involve the kidneys, brain, heart, and lungs. Kidney inflammation may result in protein leakage, swelling, and even kidney failure. Brain involvement can lead to memory loss, confusion, seizures, or personality changes. Inflammation of blood vessels, muscles, and the lining of the heart or lungs can cause pain and other complications. The severity and combination of organ involvement vary from person to person. Diagnosing lupus is a complex process because there is no single definitive test. Doctors rely on a combination of clinical criteria and laboratory findings. The American Rheumatism Association has established 11 criteria, including the butterfly rash, discoid rash, photosensitivity, mouth ulcers, arthritis, and specific blood test abnormalities. Diagnosis is strongly suggested if a patient meets 4 or more criteria, but sometimes treatment begins even if fewer criteria are present. Additional tests, such as blood tests for inflammation, organ function, and tissue biopsies, help assess the severity and guide management. Treatment for lupus aims to control symptoms and prevent organ damage. Mild cases may only require anti-inflammatory medications, while more severe cases need corticosteroids or immunosuppressive drugs. Nonsteroidal anti-inflammatory drugs, NSAIDs, help with pain and inflammation, but can cause stomach upset. Corticosteroids are powerful but have significant side effects if used long-term. Antimalarial drugs like hydroxychloroquine are effective for fatigue, skin, and joint symptoms, and can reduce flare-ups. For severe organ involvement, immunosuppressive medications such as methotrexate or mycophenolate may be necessary. Each treatment plan is tailored to the individual's needs. Diet plays a significant role in managing lupus. Many patients experience improvement by avoiding foods that trigger inflammation, such as gluten, casein, and legumes. Leaky gut syndrome, where the intestinal barrier is compromised, is common in autoimmune diseases like lupus. This allows toxins and undigested food particles to enter the bloodstream, triggering immune reactions. A diet rich in anti-inflammatory foods, vegetables, and high-quality whole foods can help reduce symptoms. Supplements like the Garden Trio, which includes Barleylife, just carrots, and Redibeets, provide essential nutrients and support gut health. Genetic factors, such as HLA-DQ gene variants, increase susceptibility to lupus and related conditions like celiac disease. Genetic testing for these variants is available and can be performed with a simple mouth swab. Blood tests, such as the Imupro food panel, can identify food sensitivities and guide dietary changes. However, certain medications can affect test results, so it's important to consult your healthcare provider before testing. Avoiding gluten and casein is especially important for those with positive results, as these proteins can worsen lupus symptoms. Proper nutrition is vital for lupus patients. The Garden Trio, a blend of vegetable juice powders, provides a broad spectrum of vitamins, minerals, and antioxidants. These nutrients help reduce inflammation and support immune function. Folate, B6, and B12 are particularly important for those with MTHFR gene mutations, which can impair detoxification and immune regulation. Supplementing with these nutrients can help manage symptoms and reduce the risk of complications. Always consult with your healthcare provider before starting new supplements. Healthy gut microbiome is essential for immune balance in lupus. Antibiotic use, especially early in life, can disrupt the gut flora and increase lupus risk. Probiotics, such as those found in Florafood, help restore beneficial bacteria, support digestion, and enhance immune function. Regular use of probiotics can improve bowel health, vitamin production, and resistance to harmful microbes. For lupus patients, maintaining a balanced gut microbiome is a key part of overall management and can help reduce disease flares. Blood sugar stability is crucial for reducing inflammation in lupus. High blood sugar and insulin resistance can worsen immune dysfunction and inflammation. Magnesium, often depleted by stress and blood sugar imbalances, is important for maintaining healthy blood vessels and reducing permeability. Regular magnesium supplementation, such as with Mag-nificence CWR, can support cellular health. Managing blood sugar through diet and lifestyle, along with adequate magnesium, helps control lupus symptoms and supports overall wellness. Omega-3 fatty acids, especially EPA and DHA from fish oil, have strong anti-inflammatory effects and are recommended for lupus patients. These fats help stabilize blood sugar, reduce pain, and support nerve health. Wild-caught fish like salmon, sardines, and trout are excellent sources. Plant-based omega-3s, such as flaxseed oil, also offer benefits. Supplements like AIMega provide a balanced ratio of omega-3, 6, and 9 fatty acids, supporting cell membrane health and overall immune function. Always choose high-quality, contaminant-free sources. Managing stress and ensuring good sleep are essential for lupus patients. Chronic stress and poor sleep can trigger flares and worsen symptoms. Establishing a regular sleep schedule, reducing exposure to electronics before bed, and engaging in relaxing activities like reading, arts, or spending time in nature can help. Practices such as grounding, walking barefoot on natural surfaces, and deep breathing exercises support relaxation and immune health. Reducing exposure to negative news and social media also contributes to emotional well-being. Supporting the body's detoxification pathways is important in lupus management. Herbs like dandelion, parsley, burdock root, and echinacea can help cleanse the liver, kidneys, and lymphatic system. These herbs support the removal of toxins and enhance immune function. Herbal blends, such as Herbal Release, combine multiple detoxifying herbs for comprehensive support. Always consult with a healthcare provider before starting herbal supplements, especially if you are taking medications or have other health conditions.
Welcome! Today I'll show you exactly how to join Beautique and make your first purchase. I'll guide you through every step, from choosing your account type to completing your order. Start by opening the main menu to explore our mission and the products section. You can join as a customer for rewards or as a member to start your own business. The sign-up form is straightforward. Just enter your contact details and shipping information. Members will also provide a few extra details to set up their independent distributorship. Once registered, browse our full catalog and select the high-quality products you'd like to try. Once logged in, simply find your favorite products, add them to your cart, and click Checkout Now to complete your order. You're now ready to start your journey with Beautique. We're excited to have you with us.